Pineapple series, and I'm Shaki Cornwall, and I'll be with you with our second guest, Miss Dr. Tonya Frame, and she'll be walking through with you the standard operating procedures as it relates to the health sector. And so, domestic violence, gender-based violence is a conversation, is something that, a lot of people are talking about. We just came from the 16 days of activism. And so you've heard a lot of chat on it on the social media, the mainstream news. And I'm so proud to be in the presence of persons who, as I said before, they've been working in this field for such a long time that we feel very comfortable sitting at their feet and listening to what they have to say around these things. And so we have no other than Dr. Tonya Frame, and she's going to tell us a bit about, her entry point into this standard operating procedure document, and how she got involved in that, and what really qualifies her to be, one of our guests on the Pineapple series, really. So welcome, Dr. Tonya Frame.
Thank you, Shaki. Thanks for having me. Thanks to your listeners and your viewers. So my entry point into this SOPs and specifically into the health sector SOPs. This was part of the joint UN EU Spotlight Initiative around ending violence against women and girls in Grenada. And I have done quite a bit of work for around gender-based violence in Grenada specifically, and around the health sector, because my background is health. I'm a public health professional. I have actually over 20 years experience working in public health, right? My undergraduate degree, my master's degrees in public health, my PhDs in reproductive health. So these are sort of the things that are in my wheelhouse. And I come from it from a preventive perspective, prevention. So looking at how we can prevent these negative outcomes, these negative behaviors. What can we do to arrest negative outcomes before they start? Essentially, that's where the public health person comes in, right? Whereas the clinical health person deals with treatment and all of those things. Mm-hmm. So I've done quite a bit of work on that front. And so this is how I got in with this. In this particular project with the SOPs, Mrs. Jacqueline Seeley-Burke was the lead. It was a team project where we looked specifically at the justice sector, the police sector, social services sector, and the health sector, in order to have a more comprehensive response to gender-based violence in Grenada, rather than the sort of silo, separate sector response that we have. There has been some coordination, but that has been a gap. And so this sort of team approach was really to emphasize that it needs to be a coordinated approach where all the sectors are working together.
Mm-hmm. Yeah, and I mean, you mentioned this word comprehensive approach, and it just, a light bulb went out in my head, because I'm thinking, why are these sectors, why do they need to merge and synchronize and work together? Like, why is that important? Why not police do their own thing? They have their own documentation. Why not health sector do their own thing? Why do they need to work together?
Right. So, I mean, that certainly is one approach, but absolutely not the best approach, right? Because of how the response is. If you think about it, a woman or a girl who experiences some form of gender-based violence, whether it's intimate partner violence, familial violence with the parents and the child, or sexual abuse or whatever, it involves all of these sectors, right? There might be a need for healthcare because maybe there are some injuries or what have you, right? Particularly if it's rape, you want to ensure that there's no pregnancy, no diseases that have been transmitted and that sort of thing. but also you want to make sure that the person gets justice, right? That it's not just you complain to your neighbor about it or somebody that you trust, and that's the end of it. You want to make sure that you get justice, right? So the health sector is part of ensuring that justice occurs, which is one of the reasons why physicians have to go to courts, right? Which is a sore point in the health sector. But that's the importance of it. You also understand that there are the psychological effects, which you know very well, Shaki, right? And then you want to ensure that those psychological effects are addressed so that it doesn't sit there and fester, because while the person may not have any physical injuries that send them to health, they may have some psychological issues that they need to address. And if they don't address it, it affects, they might be a very different person, and we're all wondering, well, what's happened to them, right? So those are the ways that the sectors need to work together. And so we need to be sending people, walking them through with hand in hand, if we need to do that kind of thing, to make sure that they have access to these services. And one of the things that came out of this, the SOPs and all of that, is the referral pathways. I don't know if Mrs. Burke talked about that, but it's a really important piece that speaks to this component of, we created a sort of directory, but also like a flow chart sort of thing, if you will, as well, so that it shows that these are the steps that if the victims, these are the different sectors, these are the different services that are provided within the sectors, and these are the contact people, right? So each of the sectors have access to that. So we should have no excuse to say, well, I didn't know who to call, I didn't know where to send them. Once you've done your screening and your assessment and you make a determination about what situation the person is in and what services they need, then that referral pathway should provide guidance as to where they should go and who they should be seeing next.
All right. And thank you so much for that. And I mean, so I'm hearing you saying, Dr. Frame, you're talking about this comprehensive framework. And I suppose from your preventative lens, what sound similar to like an ecological model of kind of addressing gender-based violence.
Exactly, and that's exactly what it is.
Yeah. Okay. I just want to check in. Is everything, because I'm seeing you for a bit, is it on my end or?
I'm not sure. You will pause for a bit. So I'm not sure where it's happening.
All right. It seems to have sorted out itself, so I'll just continue.
Okay.
My apologies. Yeah. And okay. Yeah, and so I'm happy to hear how all these things intersect, all in the best interest of the victim, so that they can have the kind of support that they need, as well as it just presents better for prevention as well, because people are also seeing a system that they can trust and a system that they have confidence in, because it's addressing, and there's clearly a reduction in gender-based violence because the system is working. So I'm happy that the SOPs kind of pull everything together in that kind of way and make that kind of link and create that kind of connection for us. I want to get a sense from you. I know the SOPs, that document is very detailed and I can see a lot of utility in it. But I want to get a sense from you, what are some of the areas, the key service areas that, as it relates to health, that it contemplates and tries to work through? Just some general ones, so that the audience can become a bit more aware of, what are some of the things that he touched on as it relates to the health sector.
Right. So the SOPs are structured around the WHO, UN agencies, essential services package, right? That actually touches on all of those sectors that I mentioned. And for the health sector, they have 6 specific service actions for health, starting with the first one, the identification of the survivors of intimate partner violence, right? So when you go to a health facility, are healthcare providers trying to determine who are victims, right? Among the people that they are seeing. Because you can go to particular service areas, for example, maternity, sometimes even optometrics and all of those things, maybe even pediatrics, right? HIV. And there are certain things that you can look for to make a determination whether or not that this person is a victim, right? Or at risk of being a victim and so forth. So it speaks to that. And then it asks us whether or not we want to be doing that sort of thing generally through the system. No, we don't have the resources to do it through the system because we can't provide the services for everybody we are to identify. But there are these key areas where we do want to look out for it, right? So we can do some elements of screening. But then you have your first line support, which is the next service area for the people who come in to help. They've had an experience of family violence or whatever, in whatever form it might have taken. And they come to the health sector as their first point of entry into the service system. Right? So rather than going to the police, they come to health. And when they come to health, they may not even say that they've had an experience of violence, right? But they've just come in with a broken arm. They've come in with a bruise on their forehead. Maybe they have a concussion or whatever, right? And then you get the stories like, well, I fell down a step or what, those kinds of things. So then it speaks to what is supposed to happen when the system first interacts with someone who comes in and reports, right? And that it should be women-centered, right? So not about the needs of the healthcare provider and of the service system, but focus on the needs of the woman at the moment. So all of the stories that we hear about the long wait time, about the lack of privacy and confidentiality, that they don't want to speak to anybody because maybe when you go to the health center, there isn't a little private space where when the nurse asks, why are you here today to see the doctor? You could say, well, nurse, say it quietly and not worry about somebody hearing, right? That you're there because you got hit or you got raped or whatever. Right? And then about the mandatory reporting for persons under 18 years and under, persons under the age of 18, as well as persons who have experienced violence, right? Injuries and certain wounds and so forth, because, right? So it deals with that. And then how the system is supposed to care for persons who have injuries and need that urgent medical attention, right? Prioritize their needs, let them jump in front of the line, those kinds of things, right? Persons who have been victims of a sexual assault and how you deal with their examination and care, taking their history, providing them with emergency contraception, providing them with HIV post-exposure prophylaxis, right? Making sure that they're being treated for any STIs and those kinds of things. Making sure that we offer them, let them know that abortion is an option, right? Because it's restricted. It's restricted within our context, not illegal. And so that within the framework that the law allows, if a woman becomes pregnant as a result of a sexual assault, she cannot have an abortion according to the law because of that. But she may have severe psychological effects that can put her life at risk. She may be at risk of suicide as a result. And that can be grounds for abortion, right? So provide the services within what the law allows, right? And then the mental health assessment and care. This is one of the weakest areas in health, right? They rely largely on the social services sector to provide that service. But it speaks to that service should be available. And the SOPs speak to, okay, if it can be provided in health, then health should have a direct link to the service providers for mental health care. And so that they can reach them at the drop of a hat, and for that service to be provided to the victim, right? But at least very basic mental health assessment and care should be able to be provided within the health sector. And the final one is documentation, which is so important for the medical legal connection, right? I mentioned victims going to court, those who decide that that they want to go through with a court matter, right? That documentation is so important, that it needs to be comprehensive and accurate, right? That there needs to be this collection of the forensic specimen. And I didn't mention that earlier when I talked about the sexual assault examination and care, but this is also a major weakness, that we don't have the rape kits. We don't have a forensic lab, right, to do these things. So this is a major breakdown in our response to victims and so on. And as well as just the healthcare providers, their willingness, and you know, we know that they are very busy people, right? Particularly now during this pandemic, we know that they're now extra busy. But when it comes to access to justice, the role of the healthcare provider, if the victim access health services, is extremely important. And the role of the healthcare provider is not to determine, for example, with a rape victim, if the victim was raped. That's the role of the justice system. The role of the healthcare, of the health sector, is simply to do the examination and document and report what they found, right? They cannot make a determination as to whether or not a person was raped, right? That is outside of the purview of the healthcare sector, right?
Mm-hmm.
And Shaki, if you would allow me, Shaki, I know I'm going on, but I want to make this one point. One of the things that we found, and I really want to make an appeal to all involved, starting with parents, right? One of the things that we found was that parents, service providers are going and asking healthcare providers to do a virginity test on their children, right? Lawyers are asking doctors to do a virginity test on a woman, a female rape victim, right? This is a practice that needs to stop. We need to stop requesting it, and the healthcare providers who are doing it need to stop doing it, right? It causes more harm than good. You cannot actually determine if somebody is a virgin, if they were raped, but sexually assaulted, by doing what is called, quote unquote, virginity testing. So please discontinue this behavior, right? It really does more harm than good. And many international agencies are calling for this to be discontinued, right? It really, really does a lot of harm. And when we did our background research on this, there were cases where, you know, we heard that people would hold down against the will of a child, of a woman, you know, want to hold them down to do the test, right? Particularly in the case of children. That is extremely traumatic, Shaki. And I mean, and you can speak for days on the psychological effect of that, right?
Yeah. I mean, you know, you've introduced so many points that I want to piggyback on, because I mean, just that window into the health response and how the SOP kind of outlined that is so powerful. And it just speaks to the amount of research that you and your team would have done but also existing research around the prevalence. Like, I mean, why do we have to delve so much into creating these synergies and creating these systems? It's a response to something that is globally affecting us. And I'm so happy to be a part of, creating a space for people to kind of better understand, the systemic responses that are being developed, because I like to think about these things as evolving. And so while you would have created this document right now, in terms of, all the information that you would have, that is present, but think about it as a document that is constantly engaging, with the victims, with the public, and any system that attempts to be effective is going to oftentimes find ways of adjusting to the needs of the society. And as you talked about the particular guidelines to these key action areas, I'm quite impressed, because I don't know how many of us, in terms of the audience, are aware of all these different areas and why that connects and relates to gender-based violence. I mean, without this conversation, I mean, I'm quite sure it would have missed some of us, that these two sectors are separate. Like, why do they touch? And so I'm hearing you talking about this screening, which helps, as a sector who has traditionally been responsible for providing medical services, saying, we have a responsibility to end gender-based violence. Yes, we attend to the medical wounds of the people who come into care, but there's a deeper wound, there's a deeper injury that's going on that's harming our society. And what can we do? And the SOPs is saying, this is what you can do. You can screen everyone that comes into, the clinic, because it's so prevalent that I'm quite sure 1 in 3 of the persons who are coming into your health center, into the hospital, is dealing with that. And if we can do what we can in our corner, we're doing something to really reduce the impact and the effects of gender-based violence.
And just allow me to make one correction, right? So we're not, the SOPs are not saying to screen everyone, right? We're saying that in those key areas like maternity and HIV and pediatrics and so on, yes, let's look out for it there. Let's do some screening in those key areas, because we don't have the manpower to screen everyone, and we also don't have the resources to deal with all of the cases that we're going to find.
Yeah.
Right. So it's a balancing act of the ethics as well, right? Because when you find all of these cases, if you screen, our system is not yet advanced enough to handle. We know already 1/3, 1 in 3, right? Women are victims. Mm-hmm. So, we can't, we're not ready to deal with all of it, but we want to capture as many of it, right? Mm-hmm. As much of it as we can.
Yeah, and I mean, just the areas that you highlighted as well. I mean, because of my work on the ground, it resonates with me so much, because these are some of the key areas that people are going to report. Their eyes, maternity, these are some of the areas that intersect with persons. Women victims oftentimes report these kinds of conditions, and just the mere fact, recognizing our limitation as it relates to resources and keying into these areas in itself can help strike a blow against gender-based violence and picking up these cases before it's too late, because we know the mortality rate as well. The thing with gender-based violence is that it escalates, and if we can pick them up earlier, then we have a chance of helping survivors escape and get the kind of help and support that they need. And so I want to ask, in terms of this, because it's also empowering, and I said the same thing with Mrs. Silly Burke earlier on, just hearing the access that you have in terms of just this information, in terms of as a victim, as a citizen, as a stakeholder who might not be in medical or in the health sector, it's empowering to understand what the SOPs outline that the health sector should do, and which means that we can now say, well, but you shouldn't be asking the doctor to do a virginity test. You should be offering prophylactics to this rape victim. You should be saying the rape kit. It empowers us. And I want you to just speak a little to, what is the relationship between this SOP document and victims' rights, empowerment, and those kinds of things. Yeah.
Right. And that's such a great question, because the SOP speaks specifically to the service providers, right? While the victims' rights, so you mentioned victims' rights, but Mrs. Silly Burke and I actually worked on a victims' rights policy earlier this year, right? And that speaks specifically to the victims in particular, knowing what their rights are. And it's very synergistic with the SOPs, because a lot of the background research for that came out of the work that we did on the SOPs. Before the SOPs, we did the situational analysis. So that situational analysis document yielded really, really rich information, because we conducted over 90 interviews, right? Focus groups and so on. So the information came from that. So the SOPs speak to how the service providers are supposed to respond, try to standardize, make it as systematic as possible, how they're supposed to treat people, every victim that comes across their door in the health sector, right? And the victims' rights policy now speaks, it tells the victims, well, this is what you should get when you come out, when you interact with the health sector. This is how you should feel. This is what you should have received, right? And it also speaks to the service providers, and it tells them in no uncertain terms, these are the rights of the victims. It speaks specifically in rights language, right? Based on international and regional and even our national, for example, our constitution, right? It speaks to the rights of citizens, of women and girls and so on, right? And so the service providers have a responsibility. It is their duty. They are the duty bearers. They are the ones who make these rights real for a victim, if you will, right? And whenever they respond in a manner, for example, the lack of confidentiality, right? That is a violation of the rights of the victim, because that victim has the right to privacy. They have a right to respect and dignity, right? In the matter of the virginity testing, they have a right to bodily autonomy. They have a right to participate in their care. And to consent to it. So really, a healthcare provider, before he or she, engages in any specific procedure, they're supposed to inform the victim, right? And say, okay, I'm going to do this, and this is what's going to happen. Explain, try to make them more comfortable. And if the victim says, no, I don't want you to do that. If you can't convince them, not force them. If you can't convince them, you keep it moving, right? Maybe if you treat them in a manner that's respectable, they may come back at a later time, right? And then you could do that procedure if it's not too late, and you wouldn't have lost the benefit of what it would have provided, right? But that's why these things are so important. And so always the initial interaction with the healthcare system is so critical, right? Because Shaki, imagine you're meeting somebody for the first time. If that person doesn't leave a good first impression when you meet them, I mean, you don't want to invest in speaking with them any further. You don't want to invest any additional time in that person, right? And especially if you feel like, you know what, I'm here already, I'm just going to go through with it, I go ahead. But that person makes recommendations for referrals and tell you, well, okay, go over to the Ministry of Social Development, or go over to Legal Aid and Counseling Clinic and see a psychologist, right? And prescribe some medication. How likely are you to do any of that? Because the trust has already broken down. The trust have already broken down between you and that healthcare provider, right? And that is a rights issue. That is a rights issue, right? So that is how these things intersect. And sometimes we talk about human rights in these sort of very global terms that maybe laymen may not easily understand. But human rights are kind of bread and butter issues, you know? you know, it's like, I want to be treated fairly. I don't want to go and feel judged. I don't want to go and feel like, you know, somebody watching me kind of funny. You know, somebody thinking, well, so, you know, it's her fault why she didn't leave him. You know, what she doing there? But wait, I didn't see her last week. She come back again. You know, those kinds of things. You don't need that, right? And Shaki, we haven't even touched on the issues with the adolescents and a whole other story, Shaki.
Yeah, I mean, I know, and this conversation could go on and on, because I mean, there's so much information here. I mean, so much things that you shared that I would definitely like to piggyback on. But in the interest of time, I just want to highlight and just ask one last question, as it relates, because you shared a lot of information, and I'm wondering, in the interest of the audience, you know, you talked about the referral pathways, you talked about the victims' right policy, we're referencing the SOPs, and these are documents that are perhaps not as easily accessible as we might think. You know, professionals
True.
and so may have access to it. But if a layman, somebody who's just, you know, inspired by the conversation and want to know more about these documents, do you know where they might be able to access these things so that they can better understand what all these things, complex ideas that we might have been trying to discuss?
Shaki, that's an excellent question. I would really direct them to the Ministry of Social Development. I think that's the best point of reference to access these documents. Hopefully one day soon, they can be up on government websites, particularly as, you know, as these things get approved by cabinet. I believe the SOPs have already been approved by cabinet. And hopefully the victims' rights policy, if it hasn't yet been approved, it will be approved soon. And so hopefully once these documents are all approved, they can be made available to the public, because, you know, us talking about it is fine, but the public needs to realize these rights, and for the system to be effective, the victims and the general public needs to know what is in them and what, you know, what their rights are.
Yeah.
So that's a really excellent question. I say call the Ministry of Social Development.
Yeah, bombard them and challenge them to make these documents accessible to the general public, because that's the only way the conversation is going to change, and that's the only way behaviors are going to change. When people are going to say, but you're not supposed to be doing that. And it would be a blessed day in Grenada when a child could look to an adult in a health center or someone and say, but you're not supposed to be doing that. And it's because of how well read these documents are and understood in terms of. So thank you so much, Dr. Frame, for being with us. It was really a pleasure. I hear Curling saying from Grenchap that there definitely will have to be a part 2, because there's so many things to interrogate, so many different ways that we can go. But I'm recognizing our constraints with time. You've done an excellent job in kind of just, you know, opening the window so that we can peek through and see what else we might need to look at to better understand what the system that responds to gender-based violence has in store. Thank you so much.
Thanks, Shaki, and thanks, Grenchap, for the opportunity. I think the health sector is one of those that really gets a very small bit of light shone on it in regards to this gender-based violence issue. So I'm hoping that this is certainly an opening for us to have more of these conversations around the health sector and the response to gender-based violence. Thanks again.